Hip impingement is a common cause of hip pain in an athletic population. Oftentimes, athletes will complain of a vague pain in their groin region with activities such as running or jumping. Oftentimes, this can go unrecognized or ignored for a long period of time before the symptoms become more severe. Hip impingement happens because of a developmental abnormality that occurs in adolescence. The hip joint is formed by the top of the thigh bone and the pelvis. The top of the thigh bone ends in the ball and socket joint of the hip joint, and the pelvis forms the socket that the ball sits in. When an athlete runs and jumps, as they bring their leg up, if there is extra bone that has developed on the front portion of the top of the femur or thigh bone, or extra bone has formed on the rim of the socket because of a developmental variation, impingement can occur, which means that as the leg is brought up into a running position, there can be bony contact that occurs between the ball and the socket of the hip joint. When hip impingement occurs because of repetitive activities such as running and jumping, the constant contact between the extra bone on the rim of the socket or the edge of the ball of the hip joint can cause injury to the labrum. The labrum is a rim of cartilage that surrounds the periphery of the socket of the hip joint. If the bones are in contact with each other as an athlete tries to run or jump, that labrum can become pinched between those two pieces of bone. Initially, that labrum will become contused or bruised, which can produce a vague pain in their groin region. If the insult continues to occur repetitively, the labrum can eventually start to tear away from the rim of the socket. When that occurs, oftentimes the athlete's pain will substantially increase. They'll start having discomfort in the groin region that they are no longer capable of continuing to play through. Instead, they will notice either a decline in their ability to perform their sport to the level of their expectation, or they will have to take themselves out of competition or practice prematurely, secondary to pain.